vascular dementia and Alzheimer's. But she's still with it enough to know that I'm not there with her.
Roseanne Riley's mother is 104. 23 people have died at her Ottawa long-term care home. Riley says her mom was left with a COVID-positive roommate for 48 hours. Saturday, she tested positive.
And if protocols are in place and we're doing what we should be doing, I mean, how does this happen?
Riley was one of several people who shared concerns about the Ontario system Friday.
Shut these houses of horror down.
She died alone. My priority now is the well-being of my father within the long-term care system, the grieving spouse.
We have to lock this down. No excuses anymore.
This week, Ontario announced increased long-term care testing and 3,000 new beds.
We are investing more than $500 million in additional supports for long-term care during the second wave.
We're seeing these homes in Ontario, which has the most outbreaks, and other places like Manitoba that never actually had staffing contingencies in place, really see the brunt of a lack of preparation.
Experts say nationwide the second wave is just as troubling. Staffing shortages are still an issue, plus there's an increase in community transmission.
In the second wave, rather than the military now, we're starting to see the Red Cross.
Half the residents of this Winnipeg care home have COVID-19, so short-staffed they're asking family members to come monitor loved ones.
Quite a reduction in staffing because of COVID transmission. The ERS team, the paramedics, are there right now.
While Saskatchewan announced a new visitor ban at care homes except on compassionate grounds, and Nova Scotia is now stopping residents from leaving for off-site visits, but the province's top doctor says visits at the home must continue.
You need to look after the care of the residents, not just their physical health, but their mental health as well. It's not okay to put barriers to that happening.
As for this 104-year-old, Extendicare tells Global News they can't speak to her case due to privacy, but that separating positive residents is a priority. Riley wants more answers.
I know she's old, but she's my mother, and she means something to me.
Abigail Bimman, Global News, Ottawa.